Behavioural Insights Team, also owned by Nesta, is a research innovation consultancy, and we specialize really in behavior change and rigorous evaluation. So if you need help with those things, think of us. In terms of what we are going to cover over the next 3 hours or so I'll walk you guys through the first module, which will be all about sort of a little bit of introduction into decision making. How do people make decisions? How do they think? Why do they do the things they do, if you will? We will together also look at user journeys and how developing user journeys, mapping the journey of your target audience can be hopefully really helpful in the development of your intervention or program. And we will also start working together on diagnosing the specific barriers, the behavioral barriers that your target audience faces. And I'm sure so many of you will have experiences with, we have developed this great product, but people are just not taking it up in the numbers that we would like to see, or maybe they are not using it on an ongoing basis. And so what we'll try to do in that section is give you some ideas as to why that might be. And then after much needed break, Sarah in the second module will then go more into, again, how you can use human-centered design methods, such as user testing and so on. Again, in that spirit of learning more from your audience about where they actually are and how to improve your interventions, which will take us to the last bit about using behavioral science or behavioral insights, maybe small tweaks, small nudges here and there to really, take your intervention to the next level. So that is kind of the plan, somewhat ambitious, but we'll get there. And so in that spirit, I'll go straight in with the first section, which is all about understanding human decision-making a bit better. Now, of course, I could go through a lot of theory here, but I thought let's just have a practical illustration of how do we actually think, right? And so this is where I'm afraid I'll need you guys to help me a little bit and to do this quick exercise with me that hopefully will help illustrate some of the biases that we encounter. So what I'm going to do next is I'm going to show you these words. I don't want you to write anything down. I just want you to spend a minute looking at these words and trying to remember as many as you can. Sarah, I will be looking at you for 1 minute mark, or maybe Chloe, if you don't mind. So 1 minute, just look at them, remember. Appreciate it's not necessarily all people's first language, but hopefully we'll get there. 1 minute is a lot of time. Okay, and now if you can take a piece of paper, pen, and write down as many as you can remember. I'm not going to mark this. This is not an exam, but just try to write down as many as you can remember. Okay? Some people have really good memory here. Are we good? Okay, so if you can humor me, did you remember the word snore? Just, shout or whatever you feel, yeah? Okay, or hands up, okay. Quite a few people. Wake? Also good. Blanket? Nice. Nap? Okay, very good. Sleep? Quite a few people. It's very funny, though, because the sleep was not on the list. Okay? Okay. I mean, this was, I must say, this is quite an extraordinary group. Because normally when researchers do this, 50% of people remember sleep. Pretty much everyone remembered sleep here. Maybe you are all very sleepy at this point. But you don't have to worry. You don't have to run to your doctor. You know, you are all fine. I mean, some of you might want to do a quick check, but anyway, all this is to say, and all we are trying to do here is illustrate that in this case, what you remember can be influenced by context, right? So obviously, all the words I showed you had some kind of connection to sleep. And so it was only logical for you to assume that sleep would be on the list, right? So what you did there, your brain used a mental shortcut. You just jumped to the conclusion. And the point here really is to say that this is how our brain works. You know, we make these sorts of mental shortcuts all the time. And the only kind of slightly tricky thing is we use these shortcuts even when it comes to really important decisions, and it can sometimes lead us astray. So that's kind of what as behavioral scientists, we have to be conscious of. So let me tell you a bit more about how this actually works. And I think a good sort of introduction into behavioral sciences, or if you will, behavioral economics, is the dual thinking model. Some of you might have heard of Daniel Kahneman, the Nobel Prize laureate, or you might have read or seen at the airport, Thinking Fast, Thinking Slow. And that is really good illustration of what we have just all witnessed, right? So Kahneman tells us that it is as if people had two parallel systems that they use for thinking. They have a fast system, which is what we have just witnessed. They have a system which is automatic, intuitive. It's very effortless. It's the system you use when I ask you, how much is 2 times 2, right? The answer pops up. You don't have to think about it. It's the answer it's the system you use, say, when you're driving. You don't even realize all these decisions that you are taking at every point. So it's very kind of effortless, low effort system. And then on the other hand, you have the slow system. Now this is a system which is much more deliberate, analytical. It's the system you will have to use unless you are a mathematical genius. When I ask you how much is 24 times 17, it's complex. You have to think about it. System you might be using when you are first learning how to drive, right? Like there is a textbook you need to learn, you need to practice, and you can physically almost feel the thinking, right? Why am I telling you this? Why is this useful? We often design policies and products and systems thinking that people are using the slow system, that people are really thinking about what is going on here, right? That they are deeply engaging with what it is that we put out there for them. But they aren't. As we have just seen, and of course, silly illustration, but there is a world of academic literature showing that even when it comes to very important decisions, like am I going to go to a university? Which job am I going to pick? Am I going to save for pension? How much am I going to save for pension? Even when it comes to these important decisions, and parental decision-making, I'm afraid, is no exception, people will still end up using the fast system. And so really, what we're saying is that we need to understand how this fast system works. We need to understand how people actually think. How do they make the decisions they're making, rather than stick to this idealized, rational version of thinkers. And as a result, we might need to design for this fast system. And we will give you quite a few examples of how you can exploit these mental shortcuts that people are using to your advantage to make the uptake of your program higher. Okay, so you might be thinking, well, this is all very nice and kind of, funky science. How do I actually then use that in practice? And that is very much what BIT does. So let me talk you through a practical example of how you can take this kind of science and use it to improve social outcomes. A good case study is a project we did back during COVID. Oh, now I'm starting to figure out how this works. We did back during COVID, actually in Argentina, in a province of Chaco, focusing on improving COVID-19 vaccination uptake. And, if you remember at the time, the uptake was pretty high for the initial dose, because that's where people were, quite worried, and there was a lot of motivation. But then for subsequent doses and boosters, the uptake was not quite there, right? So we worked with the local Department of Health, we worked with local university, and we were trying to figure out, okay, how do we get people to complete their vaccinations? And part of what we did there, and we'll walk you through exactly how you can do it, many of you might have been doing it already, was a lot of what we call exploratory research or user research on the ground. So doing observations, doing interviews, surveys, focus groups, really trying to understand what is happening on the ground and where are people coming from. And then on that basis, in this case, we designed a WhatsApp chatbot. Quite a few organizations here working with chatbot. Why? With WhatsApp, sorry. Because the penetration of these technologies in many of these countries is, at this point, quite high, right? So really good touch point. Now, what is the kind of special sauce, the kind of extra nudge that you can put in there? So as you can see in that chatbot, and I should say by that we mean structured decision tree, right? No LLM, no AI. What we did there was we introduced, first and foremost, reminders, timely prompts. And this again goes back to the point of, and we all know this, humans are forgetful. So don't underestimate how frequently they need to be reminded and prompted at the right time. So that was one logical thing that, of course, you would introduce here. The other one, slightly more complicated, was around making it as easy as possible for people to complete this action. That is really the first law of behavioral science. If you don't remember anything else from the session today, please remember this. You need to make the action as easy as possible for the largest number of people. And so in this case, what we found out when we were talking to people on the ground was that they didn't actually know where they could go to get a vaccination, right? They would go to a clinic, the vaccine was actually not available there, or the clinic would be closed. And so in an effort to make it really easy, we went into this, fair amount of trouble of creating a register of all the clinics and their opening hours where these particular vaccines were actually available, so that from a user's perspective, all you had to do was put in your postcode and we would tell you, this is the clinic you have to go to. Right? So a lot of work at the background to make it super easy for the person on the ground. And again, if you were looking at this from the kind of point of view of a rational kind of thinker and all of that, you would say, well, people know vaccines are important. People will find the website and they can find the information if they really want to. And that's all true. But the problem is that's not what most people are going to do. What you're asking them to do is maybe the 10th or 20th thing on their list. And that's where making it really, really, really easy for them is super important, right? So that was an important bit. Another one, and we can get into that more deeply another time, is we didn't just remind them to go and get their appointment at a given time, but we had them, being actively involved in that planning, right? So there is good literature showing that if you get people to make plans about what they are going to do, where and how, they are about 30% more likely to actually follow through. And so in this case, we asked them, okay, well, here is the center. When are you going to go there? How are you going to get there? And what we are doing there is we are getting people to think about it, to plan it, to commit to do it. Now, you might be thinking, this is all very well, but is it really worth it, right? And that's where evaluation comes in. And I know, again, many of your organizations are already thinking about this. How do we demonstrate impact? Now, we were very lucky in our case in that we were able to run a randomized control trial with 200,000 people. So we have really good kind of level of, robust results. And we were able to show that this simple intervention, virtually costless, can triple the vaccination uptake. Now, obviously, as you can see, it's coming from very small kind of baseline, right? So the relative numbers quite small, but still the effect size itself, very big. If you are interested in this, you can also look up the academic paper that we wrote up, available in Nature Human Behavior. We actually were able to do a replication, so are quite confident in these results. Anyway, so all this is to say, this is an example of how you can use user-centered research, how you can use behavioral science and kind of really thinking about meeting people where they are, make very small tweaks to your intervention or your program, and see quite big effects if you are able to do some good measurement. So how do we actually make a start? How do we go about this? And so this is where, again, I can't stress enough how important it is in what you do, and in these projects when we do them, really start from where people are and really understanding their experience as it is on the ground. I think one thing, and obviously we heard earlier today from Dr. Jody about the neuroscience of being a parent or being a carer and so on. One thing to be conscious of, I think, in the work you are doing, is just how much people have going on. And from a point of view of a behavioral scientist, this has a real impact on our capacity to make good decisions. Because if I am from a disadvantaged background, low resource setting, if I am on a daily basis worried about my safety, or will I have enough food, or is there some kind of a bad weather situation or whatever, it weighs on my mind. It increases what we call our cognitive load, and there have been good studies showing that it really impairs people's capacity to make good decisions. It can lower your IQ. If you're interested, the book is called Scarcity. Very good book. But anyway, so this is, again, just a little bit of context. These are the kinds of things that we have to be mindful of. And again, that is why we need to be designing our interventions and programs to make it as easy as possible and as attractive as possible, as normal as possible for people to do, because otherwise they simply won't get around it. So how do you start? So a good starting point with understanding the user experience or just getting into the mindset of user experience is with user journey mapping, right? And really by that we mean creating a map, a visual representation from the point of view of your user of what they are going through. So, it's walking into someone else's shoes and imagining, okay, what are the steps they're going through? What are they thinking about? How are they feeling? And indeed, the purpose of these user journeys is to help us understand where there maybe are some gaps in what we're doing, where there are some barriers and drop-off points. So, as I just said, the idea is to really break down your program into these small steps, which can reveal points that we can address, and think at every point about, are there, some barriers that you haven't previously actually thought about? Now, you might be thinking, well, I know my program. My program is easy. User journey is simple. Is it? A good example here is of a user journey of trying to get a coffee. This is kind of a Starbucks setting, if I may say so. And you might be thinking, well, getting a coffee, that's easy. Well, from a point of view of behavioral scientists, not necessarily, right? Because first, you need to want to have a coffee. You need to choose a specific shop. You need to be able to walk to that shop, to enter, wait in a line. You might get discouraged at that point. You need to read the menu, pick a particular option. You need to get to the front. You might get distracted. You are looking at cakes. You need to pay, so on and so forth. All this just to illustrate user journeys, not so straightforward. And when we think from our perspective, oh, it's so easy, actually people have to go through quite a few steps. And at each of these steps, your users can drop off, right? Now, that was a simple user journey. And it can get very complicated very quickly. This is a user journey we did in our work with Australia's Department of Health that maps the kind of cancer screening journey. All the different screenings at different points of time and all the contact points and so on and so forth. So not to, frighten you or discourage you, but just to recognize there is a certain complexity here to be reckoned with. So let's get into it. Let's get into practice. How do you make a start? So first, we need to determine and agree and have a clear sense of who is our target audience, and then we can move on to identifying the key steps along their journey, right? So let's start then with that first question. Oh, never mind. Determining the target audience. So, for instance, it could be caregivers from disadvantaged backgrounds living in rural Kenya, right? What we want to be clear about is really who is the primary audience of your intervention, the main users you are trying to influence. There might be all sorts of secondary people who will indirectly benefit, and you want to be clear about some of the key characteristics, because again, that might really shape your intervention and your particular program depending on people's age and their location, their language, cultural context, other needs that they might have. Right? So be really clear about the target audience. And then second, we can then move on to creating an example of user journey, which we will do together in just a minute. So here is my example of a user journey for a community organization that is supporting parents by offering parenting support, providing childcare, and in the meantime, giving them opportunities to make and sell small products, right? So first, we need your user to somehow learn about this program and the fact that it exists, maybe through a friend. And maybe then the next step is that they land on your website where they register for the program, after which you then send them a confirmation SMS. And then for the program itself, and this will be repeated for a couple of times, they will have to take the bus to, say, the community center where you are providing this service, where they drop off children at provided childcare, after which they then attend the particular course, after which they pick up their children and then again take the bus back home. So very kind of simple, slightly high-level example of a user journey that might be relevant to the kinds of interventions and programs that you guys are working on. This exercise is that it clearly helps you see what are the touch points, where are you engaging with the user, where you may be collecting data on the user that you can then use for monitoring and evaluation purposes, but also, and that's what we are going to go into next, what are the barriers that they might be facing at each of these steps that actually ultimately means that they won't follow through with your intervention or program. Now, let's then go a little bit into that, shall we? So, really what we mean here is we just want to spend a little bit of time to thinking about barriers and, yes, potentially enablers, so that we understand better why people actually may or may not engage with your program, with your intervention. And the really useful tool that we like to use to do this kind of diagnostic or analysis of barriers is the COMBI model. Super useful to help identify barriers. And basically what that tells us is, if you want someone to do something, they need to have the capability to do it, physical and mental, if you will. They need to have the opportunity to do it, and they have to have the motivation. Now, I'm sure there are in the room fans of detective stories, right? It's the same thing. The detective is always, when they are trying to find who did the crime, they are thinking, okay, did the person have access to a gun or whatever? Were they in that room at that point of time when this crime likely happened? And did they have a motivation? Did they have a reason to do it? So it's exactly the same thing when it comes to trying to identify barriers to following through with a behavior. Now, under each of these headings, there are actually quite a few specific barriers that your users may be encountering. I'll run through a couple of these. Don't worry, you don't need to try to remember these. We will give you some useful tools that you can keep and that you can continue using for this kind of thinking and analysis. But let us start with capability barriers. So I said it's about physical and mental capability to actually engage with your intervention and your program. So do parents have the physical ability to do this thing you want them to do? Can they actually get to this center where you are delivering your program? Or is it the case that it is very far away and that they would struggle with local transport and so on? Of course, many of you will be familiar with barriers around people's awareness of your particular intervention or program. So many different demands on our attention all the time. How are you going to make your intervention or program stand out? Make it really noticeable, right? You might be thinking, many of us as experts in our particular field might be thinking, well, everyone knows this or that, right? We all know that you need to, do this and that to eat in a healthy way, or that vaccination is good, or that going to school regularly will have really good impact on a child's life long term. But do your parents that you're working with actually know it? Or in this example we have here, say, do they have skills, maybe digital skills, to actually engage with your program? And we have discussed already today memory and attention span, right? How, again, are you going to capture parents' attention? How are you going to make sure if your program or intervention requires a repeated action and ongoing engagement, that they will not just do it once, but they will remember, despite all the other things they have going on, to do it over and over again? And, in case where you are giving parents options, how are you going to make sure that they are able to make these sometimes complex decisions and choices about what are the right things to do, so to say? So these are all the various barriers on the kind of, when it comes to parents' capability to engage with your particular intervention or program. So that is capability. Moving on to opportunity, that's a really interesting one as well, right? So say, okay, the parent has the physical ability to do it, they are aware of your program, they understand it, you caught their attention, but say they don't have the time and money, right? They don't have the time and money to come to that center or to spend that time in that particular way and so on and so forth. That can be a big barrier, right? Or it might be that they just don't really see this behavior you are asking them to do as something that is normal or that is desirable. We talked before about, particular kind of cultures and kind of social norms that people are embedded within. Well, maybe you are asking me to, again, send my child to school and make sure that actually the child is going there regularly. Well, in my village, no one really cares about that much. I don't have anyone in my neighborhood who is a powerful role model showing me that this is an important thing to do, right? That can be a big barrier because we take the behavior of our peers and authority figures as a real signifiers in terms of what is the desirable thing to do. And it could also simply be that, in people's environment, they just don't have the opportunities and prompts to do it. We do a lot of work in the UK around obesity and healthy eating and all of that, right? And so what you see so very often, especially in some of the kind of poorer neighborhoods, is that you have fast food on every corner. You don't have healthy and cheap food readily available in the same way. And so again, these are the kinds of barriers that parents will encounter, and as we have seen, because they are busy, because they revert to whatever the easy and accessible thing is to do, they will simply not do the right thing, if you will. So let's think about, when you think about your program, what are these barriers at every step in terms of opportunities? And we'll, again, show you quickly how to go about that. Just finally, motivation. And I think this one is perhaps the most obvious category. Here, what we mean is, okay, so parents maybe have the time, maybe they can do it, but do they actually believe you? Do they believe that this program actually can have the impact, that it is worthwhile their time and resources? Sometimes, and we know it, so many of you work with people from really difficult circumstances or groups, sometimes it's the lack of self-belief, and how they perceive themselves and their identity. They might be thinking, well, that's very well, but that's for a different kind of person. I'm not that person. You are not meeting me where I am. That can be a big, truly behavioral barrier, right? And then, all sorts of other things. It can be, humans, of course, are creatures of habit, right? So much of our behavior is habitual. It is so hard, you will know, to get people to change what they do, even a little bit. And that's kind of what you're trying to do. So much of what we do is truly automatic. How do you make them switch? So those are the sorts of barriers that you'll encounter on the motivation side. Now, how can you, again, make use of it? How can you practically use this and apply it to your intervention or program? I'll show you in a minute, but maybe just a bit of an example here, right? So I showed you these long lists of various barriers. If I go back to the example of a program I have given before, this is what a barrier analysis might look like for that program, right? So I might say, okay, so maybe mothers don't know how to sign up to the program. Maybe they will lose attention, through the modules, and they won't really get the learnings that they need. So those will be the barriers on the capability side. Looking at opportunity, maybe mothers, again, don't have the time to attend the course. Maybe they rely on buses that are infrequent, unreliable, not safe. It's hard for them to physically get there. And then motivation, we just discussed it. Well, maybe they don't believe that this will really make a difference to them. Maybe it really is making them feel bad when you make them learn about very useful things like financial behaviors, because they feel negative emotions. It exposes, the gaps that they have in their education and their understanding. You don't want to feel bad. You don't want to be in that room, right? Maybe they don't trust that, if you have those programs where someone else is taking care of their children, that, that is really trustworthy care. So this is an example of how you might take what I have just shown you and apply that to your particular program. Now, this is kind of what a barrier analysis might look like if we overlay those, right? So, as I just said, yes, whatever, there's a website that mother has to go to. Well, maybe they will struggle to actually, navigate that website or find exactly where you need them to go. Maybe they won't register because they will doubt their ability, the impact that the program might have. We discussed the transport and how that is unreliable and might put them off, and so on and so forth. So I guess the other important thing to realize, and I think this kind of makes it quite clear, is that barriers really can occur at all sorts of stages, right? It can be at that moment of initial uptake. It can be, at any point of engagement with the various elements, or if you are trying to get them to come again and again and repeatedly use your program or intervention.